All of you know the topic. It is about awareness on healthy running. And due to the various apprehensions and incidents that we have come across in the recent time, and based on many of your queries, we have thought of having this session. And we want to have such sessions on a more regular basis on some frequency. So with that, we can go on to the session. So the main agenda is not about the race that is going to happen the next week or how we are going to perform in a particular race. As we all know, throughout the life or throughout our tenure in this earth, how we want to pursue it as a hobby or a passion, and how we want to do it in a responsible way. That is the objective of this session. So let us not be constrained towards how to improve my performance or how to do well in a particular race. I think that's not the agenda. So it's about how to keep it as an ongoing process. That is the objective of it. So by running, are we running towards the inevitable? That is the end of life, or are we improving our quality of life? That is the objective that we want to concentrate on this session. So with that, I will hand it over to Krishna Mohan. Krishna Mohan is one of the Hyderabad runners, and he is part of our medical team, and he is part of our KBR runners group. And he works in the Basavatarakam Cancer Hospital, or Indo-American Cancer Hospital. And he has the running history from 2015, and he has done 4 full marathons and many half marathons, and he is a regular runner and volunteer. So with that, I will hand it over to him so that he introduces the panel and rest of the folks. Thank you.
Thank you, Arun. Thank you, everybody, for making it on time on Sunday afternoon, where we usually take a deep nap to wake up for a hot cup of tea. So it's indeed a very interesting and important session. When Arun and Rajesh discussed with us about this awareness meeting, the idea is to first calm down, analyze, and then, as Arun was mentioning, it is not about this race, it is not about any immediate thing, but then we want to make it a good awareness session so that we can plan all our rest of our running life very more meaningful and then more informed about what is happening and how to go about. So what we did is we carefully selected a panel of experts who are among us, one among us. All of you must be knowing each, at least one of them or two of them, if not all of them. All have been runners and all have spent a reasonable time in understanding the body, human physiology, and their own way of understanding and explaining to the co-runners. That's what is more important. And all have been volunteering and excellent human beings, apart from being excellent doctors and runners. So it is my pleasure to introduce each one of them. As I invite them onto the dais, I introduce each one of them. So I invite Dr. Ashwini Kumar, who is a physician and nephrologist. Nephrologist is a kidney doctor. So for the time being, we'll sit like this till I switch off this thing. So he is a transplant physician. He works at Apollo Hospital, Secunderabad. Apart from being a master in medicine, he's also a master in business, IIM. So he did his MBA in healthcare management. And more important and relevant to us is that he is an endurance enthusiast. He is a long distance cyclist. He is a marathoner and a triathlete. Yes? He is an Ironman. So he looks normal to me, but he's an Ironman. He's a running coach and a blogger. He is waiting for Ironman coach certification from one of the universities. Welcome, Dr. Ashwini. I now invite Dr. Amaresh Rao. Dr. Amaresh Rao is very dear to whoever has been running in KBR Park. He is a very lovely person and a pleasant person to meet and interact with. He is the professor and head of Department of Cardiothoracic Surgery at the prestigious Nizam's Institute of Medical Sciences, Hyderabad. By profession, he is a heart and lung transplant surgeon. And whenever we interact with him, we see him so pleasant. Whenever we see him running in KBR Park, we have a pleasant feeling. So it's very nice to have him as a friend and as a co-runner. And he has been running since 15 years. So the slow and steady, that is most important. And he has special interest in early onset coronary disease. Early onset coronary disease is about the heart, blood vessels, and also he has got a special interest in it. That is the reason why we have picked and chosen the panelists in our. Dr. Rajasekhar is a senior intervention cardiologist. You can see him, the high-tech city runners can see him running with his cap on always, and one pace, and always smiling. If you see him, he'll smile at you. He's a very senior interventional cardiologist. He is a clinical director of cardiology services at the Yashoda Hospital in High Tech City. He has got 25 years of experience in cardiology and electrophysiology. Electrophysiology is the science of transmission of electric signals through the heart, right? And this is important. He's an avid runner, he's a cyclist, he's an exercise physiology enthusiast. Please remember this. Exercise physiology means what happens to our body when people exercise. To analyze it and to come to a reasonable conclusion and to communicate to people like us is not easy. So he is an exercise physiology enthusiast. He is interested in dietary interventions to prevent heart diseases. So that is his special characters. We welcome you, sir, to this panel discussion. We have Dr. M. Phani Prashant, who is a senior psychiatrist at Care Hospitals and also at Chetna Hospital, Secunderabad. He has been running along with Dr. Ramna initially when we met him with Hyderabad Runners. Subsequently, he is running on his own, and he has done several half marathons, and then nowadays he is into the short runs and strength training. He is very pleasant and very important for us to interact, how to calm down our mind when we do several things, when we are over enthusiastic in doing things and things like that. Welcome, Dr. Phani, sir. Our very own famous coach Sunil Menon. Sir, welcome. All of us in Hyderabad, whoever has been running, will have heard of him or have known him. He is a fitness coach, a certified Ironman coach. He authored 2 books, How to Fuel Your Body Naturally and then Breathe Better, Live Better. And his achievements, this slide won't be enough. I'm sorry, but I have cut short your achievements like this. So he's a Boston Marathoner, 305, Bangalore Ultra Marathon, 75, 12.5 kilometer ocean swimmer, and he has completed 15 plus full marathons, 2 ultra marathons, and he is Ironman not once but twice. Thank you for accepting our this thing and coming to be a part of. So what we did is, as a part of the HR medical team, we have carefully curated some of the questions, thought of what runners can have, the frequently asked questions, what all things are possible at this point in time, how to calm everyone down and how to address these questions. And the person behind this, formulating these questions and then repeatedly discussing with us is none other but our own Dr. Madhu. I welcome Dr. Madhu, who is going to moderate this session. She is a senior consultant at Apollo Hospitals, Obstetrics and Gynaecology. She is also a president of Indian Society of Perinatology and Reproductive Biology. Don't bother about this. She is the big shot. That's it. Okay. And her special interests are in high-risk obstetrics and adolescent gynecology. That also don't bother. Yeah. So, so she has been running from 2014. She has done several half marathons, 5 full marathons, 2 ultras. She was awarded the Best Female Runner Award in the year 2020 by Hyderabad Runners. She has done 2 triathlons and several podium finishes in the age category. So to lead today's discussion, I invite Dr. Madhu. So what we thought is, we have got a list of questions and she will go through each one of these things. And the idea is to calm down everybody, is not to compare or something like that. And at any point of time you have any doubt, if you think the doctors here are speaking too much of doctor language, please stop them. So that we will come down and then, yes, runner language. They should speak the runner language. And over to you, ma'am.
Thank you, Krishna. Here we are, and thank you, panelists, again, and thank you, audience. 3 p.m. Sunday afternoon, I actually told Arun nobody's going to be here, and it's really heartening to see all of you. So let's start off with the more simpler things, and then we will go on to the more complicated, scary stuff. Not scary, we are here to actually do away with the scare. So we all know that WHO recommends about 150 to 300 minutes of moderate aerobic exercise or 75 to 100 minutes of vigorous aerobic exercise per week. Ashwin, this question is for you. Why should we make exercise as part of a healthy lifestyle? Let's start from there.
See, what happens nowadays, let's not think about, say, 50 years in the past, where our grandparents used to live, when everything was walking. Even walking was walking Everything was just walking and some form of physical activity. Now, in this age, as we have gone into urban life, as we have got things at the click of a button, we have become extremely sedentary. Now, this sedentary nature of our lifestyle has brought about a lot of lifestyle diseases or lifestyle disorders. Probably were not there so many years ago. Probably earlier the world would combat infective diseases, but now we are combating non-infective diseases. The most amongst them being a heart attack or a stroke. You know, something that really can make our own life and our relatives' life to cripple. What has been found out as a cause of these lifestyle diseases is not a great lifestyle, right? So the only thing that we can do is try to get back into some form of activity, what probably our forefathers probably would do. Now, we are busy, we need to earn a lot of money, we need to have a lavish lifestyle, we need to, make for ourselves and provide for our family, children, friends, dependents. So the simplest thing that we can do is get ourselves fit, get ourselves active. So running is a form of activity which needs minimum investment. So this running or any other similar form of activity, it'll improve our metabolism, it'll improve the way we burn fat, it'll improve the way our different organs try to metabolize different systems. It'll keep our heart healthy, our brain healthy, and that will lead to, and research has proven that a good, decent exercise regime, which could be any form of exercise regime, which could help to decrease these cardiovascular events, stroke events, lifestyle diseases which can lead to, death or inability or disability in the future. So
yeah.
I really agree that this is really important for us to go ahead.
Very true. And all WHO also says that if you do more than what I just now said, will also be more beneficial, but has not really recommended how much more. So Sunil, most of us actually exercise over and above this recommendation of 150 to 300 minutes or 75 to 150 minutes per week. So what are the merits and demerits of endurance sports? And also, would you recommend that we should be, a person should be mixing up various endurance sports? There are so many forms of endurance sports. So one is what are the merits and demerits of endurance sports, and should a person be mixing it?
Okay, I think it's a very good question. So, when we talk about endurance sports, we are talking something that is beyond an hour or more, right? You're either going for a run or a swim or a bike, whatever it is. That constitutes an endurance sport. Now, there's no limit. If you see, I have seen people do 21 days, 21 marathons, 100 days of running, and all these things have been carrying on because people nowadays are more want about putting it in social media, right? It's not become an endurance sport now. Running is not an endurance thing. It's become like a pride thing now, right? And that's why we need to dial back and ask us what is the objective that you want. If you want appreciation in social media and want to reach your grave faster, then do 100 days of running, do 100 days, do ultra marathons, whatever you want, you can do. But if you really want to know about your biology, you want to know where you are, because not everybody every body is different. Every body is a biomechanical machine. Please understand this. You are a biomechanical machine, and everyone has different capabilities, right? You talk about, you cannot expect Usain Bolt to do a marathon because he has a completely different physical structure than what Eliud Kipchoge has, right? And same like you. So trying to emulate someone just because somebody is running a marathon or somebody is running a thing does not mean that you have to get into it. So the safe limit is always something that you are comfortable with, you are happy, you at the end of the run or at the end of the race, you feel enthusiastic and you can still feel, not going home and sleeping all day and feeling groggy and all that stuff, So at the end of the day, you should be relaxed and you should enjoy the rest of your day. So simple bar is try to get that thing. Now coming to the second part of the question, of course, cross training definitely helps. Okay, but one thing that is the most important thing is strength training. People are ignoring strength training at all. They do 6 days of running, they do 4 days, 10 days of running, but no strength training because they feel, oh, now this is good. No, I'm running, so this is good enough for me. but strength training plays a very important role. It is like a cross training also. And, you should treat strength training as the most important, you can say, block of training
How
in
many
your
days
run.
a week would you say strength training? And should there also be flexibility and stability routine and all that also added? Let's talk about runners. We are a running community.
So, okay, so let's, if it's a very long subject, but I'll try to make it short, okay? The basic objective you need to know is, when you say strength training, like you rightly pointed out, it is not just strength training. You age. When you age, what do you lose? The first thing you lose is mobility. Mobility of your joints. Mobility, flexibility, and strength. These are the three components that define your aging, okay? And I'm going to do an exercise with all of y'all to actually test how well you're aging, okay? So be ready for that. That is at the end of the session. But you have to have, I would say 3 days a week is good enough for strength training, okay? But you have to focus on all these three components. Not only squatting. People say, oh, what is trending? Squatting, push-ups, planks. No, there's more to it, okay? Using TheraBand, you need to know what is mobility, how do you do mobility exercises, how do you do flexibility exercises, how do you do, strength training exercises. And I'll never start my day without stretching, okay? So first minimum thing, I would say every day, 10 minutes stretching, every day. 10 minutes stretching is important. One thing that I learned is lengthening is strengthening. Remember this. I'll tell you the reason why. We are all sitting here, okay? We're all sitting here. What's happening here is our hamstrings are getting contracted. We're sitting here for long hours. We're going to sit for 1 hour, 2 hours, right? What happens is this shortens your hamstring muscles, okay? And then when you go, if you don't warm up properly and you start running, you will start getting problems, your glutes. When you sit, also what's happening is your glutes are getting dehydrated. They're all cells, okay? When you put pressure, you're going to get dehydrated. So these are small things. If you understand the physiology, you'll do much better.
Thank you, Sunil. Ashwini, back to you. So, other than improving fitness through endurance sports, what other lifestyle changes should we bring about? You spoke about non-communicable diseases, and things are different now because we are doing different. We are doing things differently as compared to our, say, forefathers, ancestors, our fathers or grandfathers.
Exactly. So now endurance sports are just one part of fitness. So fitness actually involves strength, flexibility. Sunil just told us about mobility exercise and flexibility. See, strength, flexibility, rest, work, and exercises. Okay, and something to run or walk or swim or cycle. Now, other than these, now this is only one part of fitness. Other than these, we have to focus on a good diet, right? So, one reason why we tend to get these lifestyle diseases is because there's a mismatch between our intake versus the output, metabolic intake versus the output, right? So, due to our sedentary lifestyle, ease of getting junk food and processed food, let me put it as processed food, not having enough time for us to stay in the kitchen, it makes it easier for us to have a lot of these metabolic insults we intake, but we are not able to get them out very easily. So other than exercises, we have to focus on intake. One, a balanced diet. Timings of the diet tend to be very, very important. A lot of research has shown that just eating dinner a little early helps to, not store carbohydrates as fat, and helps you to lose at least 5% of weight. People say that you eat your dinner before 7:30 in the evening, you tend to lose almost 5% of weight without doing anything else. Second, another research tells you wake up in the morning, don't have tea or coffee as your first thing in the morning, and you tend to lose another 5% of weight. Just 2 modifications. That's it. And then frequent meals, avoid processed foods. Try to have foods that you need not limit on your carbs. We keep a watch on carbs.
After running 3 hours in the morning, avoid processed foods.
Absolutely. I think this is a point very well made. A lot of us, when we are all runners, so we say, okay, I can run, so let me have some sugar, let me have some processed foods, I can have a couple of pizzas in this week, But see, once in a while, a cheat day should be fine. But processed foods, they may not be completely eliminated by exercise. Processed foods make a lot of cellular changes, and these they have a lot of antioxidants. Now, antioxidants are something that can damage cells at all levels. Let it be brain cells, heart cells, muscle cells, blood cells, everywhere. So it doesn't help you to sleep properly. It doesn't help you to rest properly. It doesn't help you to work properly. It doesn't help you to focus. You gain weight, you gain fat, and that's what causes all the problems. I think so. Again, processed foods is a strict no-no. When you can avoid it, better to avoid it.
When we're still talking about diet, there are two very important elements in our diet: sugar and salt. We all know as runners, and many of our energy gels and our energy drinks has a lot of sugar. So, two questions for you. One, does sugar has any role to play in cardiovascular disease? Secondly, salt. How much is too much?
Let's take the sugar part first. Sugars, in the case now, whatever carbohydrates we take, they're actually sugars. Okay. What we have to know difference between simple sugars and complex sugars. Simple sugars are the ones that ready-made glucose, like gels have ready-made glucose. Sugar that we take is ready-made glucose. But something else other than that. One step where the sugar has to be broken down into a simple sugar. For example, say starch, say sugarcane fruit, or sugarcane the stick, or say potato, or or say rice. These are complex sugars. So this takes one more step in the body, which is broken down into a simple sugar. So coming back to simple sugars, avoiding simple sugars is better because simple sugars tend to readily get accumulated as triglycerides in the body, especially if we don't work out immediately or we don't expend it quickly. Complex sugars or complex carbohydrates are those that have to be broken down in the body by a couple of steps, and then they form sugars. In the process of breaking down, their tendency to be stored as triglyceride or fat goes down, and then they tend to provide some amount of fiber, which tends to lose out, ease our stools and makes our tummy lighter, and that helps to take out a lot of different toxins too. About the salt part of it, see, when someone is not working out, someone who's having an average routine, a non-workout day, we do not need salt to be added in our diet in any way. Okay, our food, vegetables, whatever else food that we eat, it has enough amount of salt that our body needs. But yes, when we are working out, we sweat a little extra. Hot climates, sweat a little extra. We need to add a little more salt in the body. Now, when we are working out, how do we know how much salt is really important for us? See, there are a lot of calculations you can find, Google out, a lot of apps, you'll find how much salt has to be put in, how much liquid and how much you have to have in a day. But the day you're working out, let us remember, a simple method is the day you're working out, make sure you have a little salty foods. Say, you can have any foods laced with salt. You can have salty fluids like a lemon juice or buttermilk with salt. Just make sure that doesn't taste too salty in the mouth. The moment it tastes a little salty in the mouth, we have a lot of natural ways for us to know whether things are going right or not. So if the moment it feels too salty in the mouth, that shows that probably it's a little too much salt. You add a little bit of salt. Now you make lemon juice with half spoon of sugar and a pinch of salt or 2 pinches of salt. If it doesn't give you too much of a salty taste, that is probably that's enough amount of salt that you need in the body. If you feel the salt is tasting in the mouth, that probably means that the salt is going a little excess.
Would this recommendation be different for those who are maybe above 45, 50?
Absolutely. Again, on non-running days, non-workout days, now when you work out, you probably would know how much you sweat, right? It's very important for a runner to be aware of how much he's sweating. Anyone who's sweating more needs a little bit more of salt. Anyone who's sweating less needs a little lesser amount of salt. Of course, it has to be proportionate to the fluids that we consume. You can't have half a liter of fluid and 2 spoons of salt, okay? We need to have, it has to be ideally half liter of fluid with probably half a spoon of salt. That probably would be just enough. Anyone who's more than 40, 45 years of age, anyone with high blood pressure, anyone with a cardiac disease or family history of cardiac disease, it's always better to be on the lower side of salt. And this has to be complemented with the workouts. With these history, workouts also preferably should not be too intense. it should be at little lower intensity so that your sweat rate might be a little lesser, your cardiac activity might be a little lesser. We improve aerobic fitness by lesser intense workouts. And then so ultimately we can go on low salt too.
Dr. Rajasekhar, this question is for you. We got this multiple times on our Google Form questionnaire also. So many people take up running as a form of exercise after the age 40 or 50. So one is the prior medical checkup advised, and also would you routinely advise someone who's now stepping up to a full marathon or an ultra marathon distance to undergo some tests before they actually get onto this kind of an activity?
I think it's a very important question because every time there is an event that is reported in the media, we get a lot of distress calls from a lot of runners, and they want to have a complete checkup. Some people want to have an angiogram. Some people want to have a complete cardiac workup. Because the media goes into a frenzy, and then there's a lot of negative publicity goes into the very sport of running, because then people will start saying that, okay, how much exercise is good, if you do too much it is bad for your heart and you will die. They'll say the rabbit runs very fast, but rabbit has got a very short lifespan, and then the tortoise runs very slow and it lives for ages. So people give this analogy. But then there is actually a lot of scientific data that people are not aware of. The WHO recommendation of 150 minutes of moderate intensity exercise per week is the minimum that is required for cardiac fitness. And they have seen that as the duration increases, up to a duration of 720 minutes, that's about 12 hours a week of moderate level exercise, is good for the heart. The benefits are incremental. There's incremental benefit up to 12 hours a week, after which the benefit plateaus and starts to decline. But this is for moderate exercise. But when you come to intense exercise, because when running is an intense sport, it is more than moderate exercise, I think the limits are a little lower. We should say what is good for heart is about half of it. It's about 360 minutes, or say about 6 hours of intense exercises, what is beneficial to the heart, and afterwards the benefit tapers off. It's not that it is risky, but the benefit plateaus and it tapers off and it starts to slightly decline. So, is it true that, and why do actually cardiac arrests occur in people who take marathons? If you look at the incidence of cardiac arrest in the normal general population, it's about 500 to 1,000 per million population. But if you look at the running community, people who go for marathons and endurance sport, the incidence is 50 to 100. It's far lesser. Second, so you don't have to panic. You don't have to worry that if you are participating in the marathon, you are at risk of sudden death. Second, the chance of survival of a sudden cardiac arrest is much higher in a runner than in a non-runner. Primarily because they are otherwise healthy, but also because when the event happens when the adverse event happens during a run event, there is immediate medical help, and the chance of a bystander or immediate resuscitation is also much higher, and therefore they're more likely to survive. But having said that, if you look at the cardiac arrests that occur in people who during or around the major running events, about 2/3 of them have prior heart disease. And it is, in majority of people, it is coronary artery disease. What is coronary artery disease? This is a disease that affects the blood vessels that supply blood to the heart. So there are 3 blood vessels that sit like a crown on the heart that supply blood to the heart. Because they sit like a crown, they're called coronary arteries. And when blockages occur in these arteries, because of various factors, could be because of age, could be because of diabetes, could be because of genetic predisposition, could be because of lifestyle habits, could be because of diet, could be because of various other issues. It's a multifactorial disease. So this disease could coexist along with in a person who is actually running very regularly. So what is important is not just the 1 hour or 2 hours you spend time on the track, but what you do during the remaining 22 hours is equally important, which determines the risk of developing a heart attack. So I would recommend definitely, in fact, Sunil and myself did a lot of work together on this a few years ago, and we wanted to try and evolve a protocol on how do we do a pre-participation screening. Most athletic bodies have guidelines for pre-participation screening of athletes going into endurance sport. And the basic that they advise is to have a physical examination, to have a measurement of blood pressure, blood sugar, and cholesterol levels. And most of the bodies, they recommend an electrocardiogram, a simple ECG, because there are some diseases which are inherited diseases which will be picked up on ECG. And some of these people, this usually occurs in the younger individuals. Some of them, they are not supposed to go for endurance sport because they can have sudden cardiac arrest when they perform endurance sport beyond a certain physiologic level. There's something called a long QT syndrome. There's something called a Brugada syndrome. There's something called arrhythmogenic right ventricular dysplasia. These are all scientific terms, but there are some of these inherited diseases which we can pick up by a simple ECG. So every individual, regardless of age, should have if he's going for an endurance sport, because endurance sport is different from having a half an hour on the treadmill. Endurance sport, you are challenging the physiologic limits of the cardiovascular function, right? Challenging the physiologic ability of the heart to cope with stress. So every individual going for an endurance sport, regardless of age, should have a physical examination, general biochemical parameters, simple, basically like blood thyroid level, complete blood picture, sugar level, and cholesterol level. And in addition, they should have an electrocardiogram. This is basic. For people who are over 40, we're also recommending an echocardiogram for them, because these are not recommended by the World Athletic Federations for various logistic reasons. Because if you want to get an echocardiogram in the United States or the United Kingdom, it'll take you 6 months to get an appointment. Here I can get it done in next 15 minutes. Here I can get it done for you in 15 minutes. So there's no problem. So I think for our
logistics are better.
Yeah, fine tuning to our requirements and our situation. I think anybody over 40 should have an echocardiogram, and anybody who is over 50, if he has at least one risk factor, family history, diabetes, hypertension, or any one risk factor, cholesterol, I'm recommending them the coronary artery CT scan.
CT angio?
Yes, CT angio.
What's your take on the CT calcium score?
Yeah, CT calcium score is a good screening test. If the CT calcium score is 0, you're good. I mean, you're unlikely to have significant blockages. But if they have CT calcium score is good because you don't give any dye and it doesn't give you much radiation. So everybody over 50, they can have a CT calcium scoring. That's enough. But if they've got any one risk factor, I would recommend a CT angio, because they can have non-calcified blocks, which may be vulnerable blocks, which are more likely to cause a heart attack. So there have been autopsies done in people who have collapsed during endurance events, and 90% of them have shown that they had critically blocked arteries. So, and 2/3 of them, it's been there for years, and they've been not aware of it. And nearly half of them, during the prior 1 week prior to the event, had symptoms and they'd ignored it.
So when we are on the subject, can you just tell us what are the symptoms to look out for, or what are those warning symptoms that we tend not to look at?
So basically the human body is a very intelligent machine. If you're doing the same activity day in and day out, week after week, month after month, it adapts so well that you will be able to do your 5K or 10K even if you've got multiple blocks. In fact, a month back I did angioplasty in 3 vessels to a marathon runner who participated in the last year Hyderabad Marathon, and he said 3 months back he did a marathon, he felt nothing. But he felt that he was training today and he felt something uneasy. So then he came to me when we did an angiogram, we had 3 blocks. All the 3 arteries were blocked. It has been there for ages. So that's how the human body adapts and tries to reduce the work or the expenditure of exercise, and therefore you may not realize it. But on a race day or on a given day, you slightly exceed that. You tip over the scale, then you'll have the event. So you cross the threshold without realizing it. So basically if somebody has got chest pain, breathing difficulty, and more than they feel something abnormal or unusual when they are doing what they would do normally. So somebody does 5K, he says, I did 5K, but I'm not feeling good, feeling uneasy. Slightest doubt, just go to your doctor, get yourself checked up. So, especially if somebody has got a risk factor. So that's very important. So any chest pain, any breathing difficulty, any unusual fatigue, any unusual taking unusually long time to recover. And one very important is because most people have exercise trackers. If their heart rate is not coming down, so within the first 1 minute, if their heart rate is not coming down by about 20 beats, so that means something is wrong. That means your adaptation levels are, you are maladapting to the exercise. So then you have to seek medical attention. It is in fact quite easy to seek medical attention in our country, and we should not hesitate. And quite often the mistake is because nothing will happen to me because I'm an Ironman. They think they're a man of steel.
Two of them sitting on either side.
So it's like so a body of steel has still the same muscular heart, which is the size of your fist. It has the same physiological requirements, and therefore, so a gleaming Mercedes can have a very bad engine, and it can fail in the middle of the road. So what is important is not just external health, but also internal health.
Can we also speak about heart rate training zones? So,
Yes.
one is there a very simple formula
Yes.
that it's all over the internet?
Yeah.
And is it the same for either genders? Is it different for women, men? And later I will maybe ask Sunil how we can use this knowledge in training.
Yeah, actually, yes. When we do a treadmill test, we have what is called a maximal heart rate for every individual. We take it like 220 minus age or 200 minus age. And from males and females, it's slightly different. But then they have seen several researchers have found that this doesn't accurately reflect what is the maximum heart rate. And what is important is it varies with age and general level of fitness. So they've evolved another formula called which says you multiply your age by 0.7 and you subtract this number from 207. So 207 minus 0.7 into age is your maximal heart rate. But what is more important is the heart rate reserve more than the maximal heart rate. So supposing your maximal heart rate is say 180. 80% of your weekly workout should be within 64 to 75% of this maximal heart rate. Because that's the pure aerobic zone, you are still within the physiologic limits of your heart. And only 20%, that's your high intensity training or your weight training or whatever, your what you call speed training or intervals, only 20% should be beyond 75%. 80% of your training should be 65% to 75%. There are several techniques in which you can do that. You can use the MAF method. You can use, Sunil will tell you a lot of interesting ways of how to control your heart rate. Control your heart rate by your breathing and stuff like that. So 80% of your workout should be in that range. So what is more important is the heart rate reserve. Heart rate reserve is your maximal heart rate minus your resting heart rate. So the higher the heart rate reserve, the fitter the heart is healthier. Because good professional athletes have a resting heart rate of 40. Like Bjorn Borg had a resting heart rate of 38 and his blood pressure was 80 by 60. When he had reported to Yashoda ICU, he would have been admitted in the ICU and started on IV noradrenaline. But then that's how it is. Like a lot of endurance athletes have very low heart rates. So if you have very low heart rate, but you can reach it to a very high heart rate, you have a very high heart rate reserve. And people have seen that anybody who has got a heart rate reserve of less than 80 has a 3-fold risk of sudden cardiac arrest. So people who have a low heart rate reserve have a higher chance of a sudden cardiac arrest. So these are factors. So this an individual who is participating in a marathon wouldn't be aware of it. So you have to go to a proper coach. And then, and that's why, every person who wants to start a marathon at 40 or 50 should have a pre-participation health checkup. And it's very useful. Pre-participation health checkup helps picking up a lot of small latent abnormalities. It's not that, if I had a knee pain when running, I go to an orthopedician, he'll say, "You stop running." It's not like that. So if somebody comes to me and says, "I want to go for a marathon," I do some tests, I've had some block, I'll say I will treat them, give them a rehab time, give them a period for rehab and recovery, and they can go on. Many of our patients who had bypass, who had angioplasty, who had very weak hearts, they went and finished many full marathons, and successfully and safely they've done it. So what is important is, yes, the heart rate reserve of course, you have the heart rate zones, and Sunil will tell you zone 2 running and zone 3 training and stuff like that. And most of the trackers have the zones. So it is good to be within 65 to 75% of your maximal heart rate 80% of the time, and only cross that only 20% of the time.
Very encouraging to know that even after a bypass, one can get back into running. Not to say that we should not have a bypass, but then we are here to understand how not to have that bypass. Let's go on to something which we all identify with. We are all here because we are all part of the Hyderabad Runners community. We are all part of running communities. Dr. Phani, question to you. What are the advantages of being part of a running group or a community? Is it all advantages? Are there any drawbacks? We also have online running communities. I mean, it was there even before the pandemic, but even so more after the pandemic had started. It is very helpful and helps us all encourage each other and all that. But is there also any flip side towards sharing a lot of our training and achievements and all of that on social media? So,
Basically, the running group, runners group, community-wise, if we look at it, even WHO defines health on physical, mental, as well as social well-being, not mere absence of disease. That's what's the definition of health. So when we are coming into a community or a group, we are actually connecting to people. We are actually learning more things. We are identifying with ourselves with some group, that we are also becoming part of a group which is towards health. Actually, you're making a stepping stone towards your health. So identifying with a particular group, sense of fulfillment, achievement, and then trying to get that identity that I am also doing something for myself to get into a healthy lifestyle. So these are the good things about it. And then I also see that people, I've heard a lot of stories, I've seen them personally myself, that connecting to a different group of people, identifying, and then that becomes a part of an extended family. People get into friends, and then they get into family. I had one night I had a call from the runners group itself saying that one guy is in difficult situation, and then all the runners group actually came in the middle of the night and they got him admitted in my hospital. Okay, so that's the sort of social support which comes with a group, which is very, very really advantageous. Okay, so that's something which all of us should understand, that it's a good thing. That's the positive side of being in a social group. But the other thing, as Sunil pointed out in the earlier thing, that running has become more of a sport to show off, okay, and then put yourself on the social media, even though it is low maintenance exercise on one side. But once you get onto the social media, what is the type of shoes you're supposed to wear, what are the Garmin watches you're supposed to buy, what is the tracking you're supposed to do, what is the heart rate zone you're supposed to be there, and how you have to eat, what you have to drink. Okay, all sorts of things start getting onto your nerve, and then you are getting into peer
WhatsApp
pressure.
University is
Flourishing, yeah. And then you get tremendous knowledge as to how to, starting from how to run, how to step, how to breathe, how to drink, how to eat, how to sleep. Every part, each one of it is an article, and then the peer pressure starts building on you. Okay, so that part of it, every one of us has to be clear as to why are we starting to run. Is it for our health? Is it to get a sense of achievement, that I want to get into this half marathon and I want to achieve this in my life? I want to run at least one marathon in my life and see that I am
That's
so
how
fit.
it starts, guys.
Yeah,
I just want to have one half
yeah. So I myself was pulled by my Dr. Ramnath, the psychiatrist, who is very well known in this group, according to me. So he actually encouraged me that you're running reasonably well. Why don't you start a half a marathon? I thought only half marathon, and then it went from half marathon to Goa marathon, and then to another marathon, and then I realized I'm spending a lot of time and energy and money as well into the whole marathon thing. It is going beyond a particular point where it is infringing onto my personal space as well. Okay, so coming back to that, whether we are doing it for health or to achievement or as a stress buster, or you're feeling lonely and you want to be part of a group where others are meeting up, and that's why I'm actually getting into running. So what is your main idea of getting into running? Is something all of us have to step a little back and then think, what is this marathon meaning to me? What is this half marathon meaning to me? Why I have to? So getting pressurized, okay, and then getting carried away is something which is a flip side of this social community, is what I feel. And then all of us should not get into it, okay. And then we should not let our personal space or family time or our work space get affected and get stressed on to that I have to do it, whether it is straining my body, it's straining my relationship, it's straining my affecting my work. I still need to continue. That strain you should not take. That's what I think is.
Thank you. Dr. Amaresh, runners in their 40s and 50s kind of always shy away from doing speed work in their training. So, warning symptoms, of course, Dr. Rajasekhar spoke to us about, but how to kind of look out for these? I mean, is it okay for everybody to go in for speed work, or are there any symptoms you look out for and then step back? How would you, what would your advice be about this?
You know, this is a question directed at people 40 or above 40 or above 50. But everybody in this room looks less than 40 years, so don't worry. See, out of this panel, everybody is like 99%, 98% record holders, you know, 98% marks, 95% marks. I'm the only guy in this, probably in this room, 50% pass mark leke, grace marks leke pass ho gaya, and I'm very happy about it. You know? Nobody will know the pleasure of passing with 50% grace marks than anybody else. So if you are looking for inspiration in this room, you can look at triathletes, you can look at ultra runners or whatever, but please look at some people who enjoy running and who enjoy the milestones of their friends as well.
Awesome,
You know?
awesome. Very good.
Why guys above 40 or 50, why the guys or why the people above 40 fall into a special category is, there are two things. One, I'll give a medical analogy. I always tell my patients that up till 40 years of age, body will forgive whatever you do, crazy things you do. 40 to 60, it gives you a time to correct yourselves. And beyond 60, it will punish you. You know, probably for runners, maybe 10 years you get it down a bit. But the most important thing about guys about 40 is their mind runs faster than their bodies. Huh? So, you know the syndrome, how dare that young girl over there calls me an uncle? It's generally a girl. So the mind is willing to do more and more things, but the body is yet to catch up. So that's why, it's very important for us to realize, why are we running at all? You know, is it to build up our health? Is it because my wife is forcing me every morning? Is it because is it because I can go for a chai every morning with friends, or I can go for a beer every weekend with people, or is it just to enjoy our company, or what? No goal is good or bad. We're not being judgmental, but we should have our goals very clear. And one of the key things, we all know that beyond a certain point, our body keeps losing strength. So therefore, we have to build up strength as well. This is already well covered. Do you want to build up speed? Well, if you want to speeden up, you can build up speed. There is no contraindication, you don't become an uncle just because a young girl calls you an uncle. So, but then there should be a way to it. There should be a method to it. I won't call it a madness, but if there's no method to it, then it's a madness. Then you are only abusing your body and you're making it prone to more and more injuries. So, we have now, in words of Rajesh himself, what was once a casual amateur, they have now become serious professionals. And, you start thinking yourselves to be a serious professional just because you have completed a few marathons. And that's when you have to catch up with reality. So anything which involves not just running, any activity which involves more than 1 hour of intense activity, work out a plan And if you want to build up strength, yes, do it according to a plan. Get a proper coach, get some proper guidance, and yes, definitely you should build up for your strength as well as speed.
Thank you, Amaresh. Sunil, for you, so what are the performance indicators a runner needs to analyze in his or her training data to ensure that their heart is in a healthy condition, which also may give them an indication to seek medical help if necessary? And in this, if you can also maybe, I mean, is this also related to the way we would want to use heart rate training zones to, train? I mean, this is all related, is what I want to.
I think so. So, see, as a coach, when I define heart rate zones, it's even more aggressive. So I don't go with maximum heart rate. I go with something called as threshold heart rate, which I calculate based on certain formulas. So in case you all want to know what's your threshold heart rate, which you should not cross, you can connect with me later. I'll send it to you based on your date of birth. So there's a formula which I personally use as a coach to actually understand that this is the threshold. So which is much below than the maximum heart rate or maximum reserve. So I always make sure that's the first point, right? The very simplest thing that y'all can do, is to first identify what is your threshold heart rate. That's number one. Once you my age and my heart rate, suppose I'm 50, okay, I should not be crossing 163. Suppose that's your limit. And you have your Garmin watch, you just set an alert, okay, heart rate 163 or even 162, to be even more conservative, 160, break into a walk, okay. There's no harm in doing a run, walk, run. All my training methods are with run, walk, run, right? I mean, there are a few people who are coaching with me. Okay, so they'll vouch for it. I always say, okay, 150 meter, 1.5 meters walk, run, and 100 meters walk. Take it easy, hydrate, do this. So always do a run, walk, run. What happens is this gives your body time to recover. Okay, there's no such thing. I've seen people, feeling shy to do a run, walk, run just because they'll see, "Arey, ye kyun chal raha hai? Why is he walking?" It becomes an ego issue, right? Oh, when I am running a marathon, I should be running. I should not be walking. So there's no such rule that should not be, running. So do a run, walk, run. So after you identify your threshold heart rate, from there we define the zones. What is zone 1? What is zone 2? What is zone 3? And then we do like Dr. Rajasekhar told, we always do 80% training in aerobic zone and 20% in intense zone. So that's how we plan it out. It's mainly structured in a way where you will not at any point of time not cross your safety limit. The other thing that I always recommend, and I always tell this to people, is to do nasal breathing. Breathe in through your nose, breathe out through your nose. Okay? Breathe in through your nose, breathe out through your nose, and rhythmic breathing. Synchronize your steps with your breath. In my book about breathing, I talked about synchronizing your steps with your breathing. Why it is important? If you have an engine, you start your car, right? It has pistons. If the pistons are not in sync, it's going to be staggered, right? So when you synchronize your breathing with your steps, you are actually optimizing your energy resources. And when you do nasal breathing, you're always in your safe zone. You will never exceed that Lakshman Rekha. Because you cannot have a very high rate with a heart rate with nasal breathing. Of course, when you hyperventilate through your mouth, okay, that is time when your actually heart rate will shoot up. So training under the safe zone, that is the most important thing. Nasal breathing, breathe in through your nose, breathe out through your nose. The other advantage of breathing in through your nose and breathing out through your nose is nitric oxide is generated in your nasal passage, which is basically a natural dilator. Okay, so this relaxes your blood vessels. Okay, so this is the basic science of it. So more you practice this, the more you'll get benefit out of it. The other thing which I have always talked is people do all type of strength training. You do breathing, you do running and all. But have you ever done lung strengthening exercises? Okay, your lung is also a muscle, inspiratory muscle, expiratory muscle, right? So we have not strengthening our lungs also for making. So there is strength training for lungs also, which is very important. So look into those aspects and try to be a complete athlete. I would definitely say, get in touch with a coach, not necessarily me, but get in touch with a coach does not mean you get in touch with any coach. Nowadays, everybody is a coach. The sad part is if you've done a sub 3 or you've done a thing, you become a coach. You become qualified as a coach, which is a joke, actually a joke, and the reason why I've come out of Facebook and Strava and all that stuff is because I was seeing this madness going around. I tried, okay, let me come out of Strava, let me come out of Facebook. Now then WhatsApp group has started, Again, people keep posting about their, tremendous, incredible journeys, unbelievable journeys through WhatsApp messages. I still try to maintain my mental sanity. Sometimes I do get carried away and I talk about this, that, why are you doing these things? But it's very important that, you train properly, and please hire a good, intelligent coach. Don't coach under anyone who is a good runner. A good runner need not be a good coach. Please let me tell you that, okay? Because first thing, I do not know in this room how many people understand their human biology. You expect a doctor to know, but you should know. What is the job of a spleen to do? What does your spleen do? Where is your spleen? Does anybody know where their spleen is? Non-doctors. Do you know where your spleen is? Sorry? So, which side of your body is your spleen? Which side of your body is your liver? Where are your kidneys? What is the function of a kidney? What's the function of a liver? As an athlete, if you are running this body, you do not know its user's manual. Okay, you do not know the user's manual, and you're running, which is a very big harm. And I know 99% of the coaches also do not know where their spleen, what spleen does, and where it is, and where is the liver, and what it is functioning, and all that stuff. Okay, so guys, understand yourself, understand who you're going under, and take an intelligent call. That's all I would say.
Thanks, Sunil. Phani, back to you. So, we were just now speaking about social media and all of that. Also, how does one check himself or herself from, playing this comparison game? You're always comparing yourself with your running companions, or sometimes from your own form that was like, say, 5-10 years back. I was doing the same thing then, I was faster or whatever, and now I'm not recovering. So how do you kind of get out of this?
Okay, so running is a good sport in that sense that all of you must have heard about runner's high. Okay, so not everybody experiences it as far as I understand, because I've had 3 half marathons. I didn't really experience. I experienced it only once. Okay. So runner's high is that the sense of contentment, fulfillment, that kick which comes out of finishing a half marathon or a marathon. Okay, so the common explanation a lot of people give is there is a lot of endorphins in your body, opioids, okay, which generate, and this is what gives you high. But latest research says that it's endocannabinoids. All of you must know marijuana, the weed. Okay, so that's something which endogenously is produced in your body, is called as endocannabinoids. That actually gives you a high. Okay, so once that high is there, okay, and you're getting used to that high again and again every time you're actually running for a long distance, let's say every Sunday marathon or a 10 kilometers run, you do, and then you started getting that high, and then once you not doing it, if you're becoming very restless, you're not able to see that high in you, you're not able to feel fresh, you're not feeling that contentment, or you're not able to focus on your work, you're feeling very irritable, okay, then the problem is starting. Okay, so when does a normal physiological act of contentment, fulfillment, and then feeling relaxed after the marathon, able to focus well, these are the positive points of running regularly, is that a good exercise should be able to make you more healthy, focused, and then able to enjoy life, okay, in the full extent. Not only in the professional as well as in your personal life as well, you should be able to enjoy that. Okay, but that enjoyment, when it becomes a little of an obsession, okay, slowly it starts getting into that every day I have to go. Okay, so when I'm actually having to finish my clinic by 8 o'clock, and if some 2-3 patients come in the night, I get very irritated on them. Okay, next day morning I have to go at 5 o'clock for this marathon, I have to sleep at 9 o'clock. Why are you coming now? Okay, so that sort of a thing, it's now killing my, okay, that if I'm not going next day morning, okay, my irritation is starting to come into place. Okay, if my wife says next day morning we have to go to this occasion, no, I have to go for running. Okay, there's no way I can miss my run. Okay, that is my priority in my life at this point of time. And so the addiction part of it is that one is all addictions are similar, whether it is physiological exercise or running or any other substance use as well. When people start developing tolerance, like that same kick is not coming for 5 kilometers, which I used to run, now I have to run for 8 kilometers or 10 kilometers. I'm having to increase that every day. Okay, and then I'm pushing myself in spite of my having a knee injury or I have an IT band, I'm having a knee ankle pain. I'm saying, no, this will all go. Once I running, I'll start getting better, I feel better. I'm not getting rested after finishing my run. Okay, this will also pass away. I'll just need to maybe pace a little better. I should pace myself much more better. I'm doing it 7.5. I should become 6.5, 5.5, whatever. So the once the tolerance is developing, okay, and then you are using your body against yourself in the sense that your body is telling you, stop, don't do this to me. Okay, even the injury is happening. You're having exhausted feeling. You're having to sleep in your work hours, okay, to recover. So then also you're continuing to do it, okay, in spite of the negative consequences. And the most important, you're neglecting all your socio-occupational functioning in the sense that you're not able to give time to your family, your growing kids, attending parents, teachers meeting or whatever. Okay, your kids' functions. And then your own family or your own friends groups, which you used to meet previously, now because of your tight schedule of running every day morning, you're not able to do. And your meetings and other office works and deadlines and all those things are also there. So if you're not able to address those areas, then it is actually becoming a addiction. Okay, you're no more actually doing running for the sake of enjoying, nor for good health, nor for losing your weight, but it's become an obsession in your mind. You are going. At the end of the day, you are likely to become a loner. In spite of being in a big community and you're running with a group and all those things, you'll still become a loner at the end of the day. Okay, these are all warning signs when people actually go to running as an obsession.
And this is why we are constantly wanting to increase distances from half marathon, full marathon, ultra, and this. Yeah. Okay, thank you. Yeah. So Ashwin, this is for you. Recovery. How does one recover like a pro? Are any supplements required to ensure proper recovery from endurance training?
Before I go on to this answer, can I just make a small point about the stages of exercise and adaptation? So before this recovery part, now let us know there are basically 4 or 5 main stages, where our exercise helps us get better in whatever ways. So one thing we have to realize is every time we run, our body is getting micro injuries. Every time we run, we're getting micro injuries, right? So first will be a stage of induction. Induction is the stimulus of the workout, okay? Induction. That causes second stage injury, right? The third stage is recovery, okay? Induction, injury, recovery. After recovery happens, once the body recovers from this injury, then there's a stage of adaptation. Adaptation is that phase when we are getting a little bit better than what we were before, right? And once we have these, so every cycle of our workout should include this phase of induction, that is the running, okay, or whatever workout, induction, which we know it will automatically cause micro injuries. It should have a phase of recovery. Recovery is the phase where the injury is going to get better. Injury has to get better by, say, rest, nutrition, I'll come to that, rest, diet, fluids, electrolyte, etc. This will lead to better adaptation. So these are small cycles. So as these small microcycles of induction, injury, recovery, adaptation go on multiple times. So say you have one cycle per week. If this induction, injury, recovery, adaptation of 1 week gets into like say 12 weeks, probably that 12th week adaptation will be far better than where you started on the first week, right? If we do not have this phase of recovery, you have an induction, injury, induction, further injury, Induction, further injury, induction, further injury. Initially, when you start, you won't realize it. There'll be a certain phase, you'll improve your level, say, maybe for some time, at a certain level, and probably you'll plateau. Then you'll realize that my colleagues are going far better than me. I'm not doing better. Last 3 weeks, I'm not better. Why is it happening? Then slowly you'll realize that you're getting slower, you're getting tired easily, you're getting more injuries, you're developing an ankle sprain, you're developing back pain, you're not sleeping well, you're not having your proper energy levels in your whole day. When you miss these recovery phase, injuries keep on happening, and suddenly you realize you'll find a friend who's not coming for running anymore. And 3 months later, you'll realize he'll say, "Oh no, yaar, running, I'm not able to run anymore. Now I've started cycling." We'll have a lot of people like this, and people have stopped running, believe me. 3 months, 4 months, 5 months, and that's it. They stop running for the whole life. We don't want this. Let us focus on recovery very, very well. Understand induction, injury, recovery, only then adaptation. That's the next induction that we're going to have. So, how does Eliud Kipchoge recover? Pro athletes, the main thing they use for recovery is they make sure they get 8 hours of sleep. How many of us get 8 hours of sleep? No. Well,
Show of hands. How many of you are getting 8 hours of sleep? It's like literally a handful. I've got 5 hands up. It's literally a handful. Night sleep.
well, so let's leave out pro runners. For us, for us, running is not a profession. We run for health. We run for fun. We run for fitness. We run because, we have a lot of stress related to relationships, work, family, everything. Running is the place, a lot of people might agree with me, it's a form of meditation, we tend to cool off, right? So we run for one of these reasons. With our work, we probably, maybe not 8 hours, 6 hours of sleep probably would be just okay. So first thing in recovery would be at least 6 hours of sleep, and these 6 hours of sleep, we have to understand, sleep has 2 cycles. If I am getting to I'm using a lot of medical terms. Please stop me. Okay. So sleep. The reason why I'm stressing more on sleep is we got to know this. The 6 hours of sleep that we have, all of us. I think Dr. Phani might be able to explain to us better. Sleep. 85% of our sleep and 15% of our sleep is divided in 2 parts. Okay. The 15% of sleep is called as REM sleep, or rapid eye movement sleep. And 85% of a sleep, roughly 85% is a NREM sleep, or non-rapid eye movement sleep. Now, the reason why it is REM and non-NREM is when people are observed when they're sleeping, you can really find the eyeballs moving left, right, left, right, left, right, left, right, 85% of the times. That maybe might last for around, say, 45 minutes to 1.5 hours. This REM, the significance of the REM sleep is that it helps the brain to recover. It helps the mind to recover. It soothes the nerves. It soothes the brain cells. Okay. So anyone who is not having enough of REM sleep, probably he's the person who might not be able to focus on his regular jobs. He may not be able to concentrate on his regular stuff in the remaining part of the day. So REM sleep is very important for our brain or mind to recover. 85% of the times is the NREM sleep, or the non-rapid eye movement sleep. Now, this NREM sleep is important for the other physical part of our body to recover. This physical part of our body, this NREM sleep, all anabolic activities occur. Now, there are 2 types of metabolic processes. One is a catabolic activity and one is an anabolic activity. Catabolic activity is where things are broken down. Like we eat a complex food, the complex food is broken down. So proteins are broken down into different parts and come to baseline amino acids. Carbohydrates are broken down and come into simple sugars like glucose. This is catabolism. Okay, cells are broken down, the catabolism. Anabolism is where amino acids start building up back into proteins. Simple sugars like glucose, fructose, galactose, they start getting built up into bigger forms of carbohydrates like glycogen. This is glycogen stored in muscle and liver, right? Anabolic activities. And all catabolic activities, they give rise to more of bad fat, triglycerides. Anabolic activities uses these triglycerides and uses the other lipoproteins and helps us develop something called as a brown adipose tissue. The brown adipose tissue is a healthy fat that is in the body, right? So anabolic activity is important for tissue growth, tissue recovery, strength. It's very important for us to have these 6 to 8 hours of sleep where 15% has to be an REM sleep for mind-brain recovery. 85% has to be important for anabolic activity for physical recovery. So whatever injuries happen in our runs or daily activities, we tend to recover during our sleep. So this is the first thing, is a good sleep. Let us remember. Second, nutrition. I'd like to have a show of hands. After a workout, how many of us feel that we need a very high protein intake in the form of, say, protein foods or, say, protein powders or protein shakes? How many of us need a high protein intake immediately after a workout? We have to have a high protein intake. I mean, this question is for, we have to have a high protein intake immediately after workout, without which it's not going to be good for us. Quite a few. How many of us would feel that, no, protein is probably not really important immediately after the workout, but yeah, maybe generally over the day, if I'm having a good protein intake, it's okay. Okay, we have more for this. So, a lot of times, what we have to understand, whenever we work out, okay, our workout involves expending a lot of energy. And whenever we work out, the blood flow goes to all, important organs like the heart, the brain, right? And the blood flow to the abdomen tends to come very, very low. When we need good digestion to happen, blood flow inside the tummy to the intestines has to be very, very good. So immediately after workout, say for the first half an hour to 1.5 hours, we need to have foods that have to be easily absorbed by the intestine, right? So immediately after a workout, a high protein intake may not really do too well to your tummy. It might cause more of a bloating sensation. But yes, we have to have a protein intake of, say, roughly 1.2 to 1.7 grams per kg, or average 1.5 grams per kg of protein intake. So someone, if he or she is, say, 80 kilos body weight, around 120 grams of proteins would be just enough for a whole day's protein intake. That could be any form. That could be in form of vegetarian proteins, non-vegetarian proteins, whatever you wish. If you like protein shakes, eggs, it's just your wish, but try to space it a little evenly. Immediately after a workout, we have to focus on basically two things. One, good hydration, replacing the water that you have lost in your workout, replacing the salts that you have lost in the workout, and replacing the carbohydrate, replacing the energy that you have lost in the workout. Okay? So for the first 6 hours after workout, say a Sunday long run, we do a 2-hour or a 3-hour workout. The next 6 hours, you have to try to replace the energy that you've lost in the workout. In that, maybe around 50% should be through carbohydrates. Maybe around, say, 20 to 30% through fat and 20 to 30% probably by proteins. Okay? Any other day, try to make sure that we use non-processed foods for carbohydrates. Non-processed foods are those foods which are probably whole vegetables, whole fruits, probably even...
Not in a box.
Not in the box, right. Probably even the pasta you make at home probably will be non-processed. That also probably will be good. You'll have rice, you have potato, you have anything is non-processed. Don't put too much oil. Don't get it from the market. Don't preserve it. That probably is something that is not sweet. Something that doesn't taste too sweet, probably that is non-processed, right? So protein intake is very, very important, around 1.5 grams per kg per day, but space it throughout the day. Don't try to push it immediately after workout. Of course, if you're used to having a protein along with a carbohydrate after the workout, if it's suiting you well, please go ahead. But if you feel that high protein intake immediately after workout is not giving your tummy, not keeping it too well, avoid it. Take it over a longer period of time. That doesn't matter. Third thing here is hydration. Again, I put a little bit of hydration beforehand. Now, everyone needs to be aware of how much water, fluids, electrolytes that they need to take. How are we aware? So some people sweat a little more, some people sweat a little less. Now this is something that is different for each and every person. A good measure to know how much water you might need in a workout is doing a sweat rate test. Some people advise you do a nude weight before you start your workout in the morning, especially in the long runs. Do a nude weight before you start. Do a nude weight after you come back from a run. Factor that for amount of water that you have had during the run, right? Suppose I was say 75 kilos before I started the run. I'm 72 after I finished the run, so I've lost 3 kilos. But in the meanwhile, I have also had 1 liter of water, right? So I have lost 3 kilos, including 1 liter of water. So actually, I have lost 4 liters or 4 kilos. 1 liter of water is equal to 1 kilo. So I've lost 4 liters of sweat. So I have to try to replace at least 70% of that in the next 6 to 8 hours. I have to try to replace at least half of that in the next 2 hours, right? So make sure you get aware of that. So based on that, you know how much water you need to drink on your race day. So when we talk about recovery, you have also these carbohydrate and electrolyte drinks that helps to aid recovery. Just make sure that whenever you dilute these carbohydrate and salty drinks, just make sure how you feel while swallowing them. If you feel they're too salty, if you feel they're too osmolar, that is, you feel when you drink it, you feel the throat is getting stung. If you feel no, throat is getting more dryness when you have it, probably it's too concentrated. Dilute a little more, right? So just try to maintain this. And the fourth thing would be in the recovery process after sleep, nutrition and hydration would be, don't space out intense workouts too frequently, right? Generally for amateur runners, beginner runners to amateur runners, maybe around 3 runs per week might be just enough. In that, probably there'll be 1 long run and 1 intense run. Slightly more advanced runners, they probably would run around 4 runs a week. The reason being, in the other 4 or 3 days, we need to have rest, we need to have strength training, we need to stretch, we need to do cross training. So all these strength training and the stretches, cross training, sleep, all will aid in recovery.
Thanks, Ashwin. It's quite comprehensive. Okay, now let's talk about the most common question that we actually got from a lot of them in the audience. And I want both Dr. Rajasekhar and Dr. Amaresh to talk about this. The question on everyone's mind is the increase in adverse cardiac events, which has been happening off late. How much is COVID responsible? And I mean, it could be a combination of any of these. It could just be that maybe people had stopped or decreased their physical activity during the pandemic for a year and a half or so, then went back to it. So whether that was the cause, is just having had COVID infection one of the causes? Are any of the vaccine, any types of the vaccine, there have been many, is that responsible? So a lot of people are worrying about this.
Yeah, frankly, we do not know the answer to this question. There are definitely, we have noticed that we have had a small uptick in the number of younger patients coming in with cardiac events post-COVID. And whether there's a relationship to the vaccine, I don't think there's a statistically significant relationship to the vaccine, at least not that we have observed. But definitely post-COVID, we have seen a small but significant uptick in the number of younger individuals coming with cardiac events like heart attack and things like that. But that is, of course, that is there in the general population. There's nothing specific to runners. But obviously, if somebody has had COVID, which in some situations has been quite a severe illness, or anybody who's recovering from any illness, I think they have to be extremely slow when they restart their exercise program. They have to do it with the advice of a doctor and under proper supervision of a good coach, like Sunil has told you, a coach who actually monitors you. There are several rehab units, where there are physiotherapists who actually make you go through a graded exercise program and see how you can get back to your original level of fitness. I think they have to go slow and start slow And I think that's the only way forward. Though we cannot rule out COVID as a significant cause, but then that doesn't prevent somebody who's recovered from COVID to get back to normal fitness routine.
Let's have a show of hands. How many people think that COVID has caused increased cardiac events and heart disease? And how many feel vaccine has caused this? Well, I'm the first recipient of the COVID vaccine in the state. So I wouldn't put my life on the line if I wouldn't have faith in the vaccines which we have been taking since our childhood. Much before the start of COVID, even as early as 2016, 2015, we realized that there have been a lot of patients who are coming for surgery at a very young age. So we did a study in Nizam's Institute. We did a study. I collected all those papers. In fact, we did two studies, one in collaboration with Institute of Genetics, and the other we did on our own. What we found out was that randomly we thought we'll get guys less than 40 years or less than 45 years. We'll just study them as a group. And we were surprised we got so many numbers. And we realized in that group, the most common risk factor was hypertension, 50%. Most of them were undiagnosed. By the way, the average age was something around 38 years. Mind you, 38 years, these guys had triple vessel disease. These had the most severe form of cardiac disease, which required intervention. A lot of them presented with a heart attack, and a lot of them were quite symptomatic. That's why they had actually agreed for surgery as well. So a lot of them had undiagnosed hypertension. About 1/3 were diabetic, less than 1/3 were obese, and less than 1/3 had the conventional risk factors. What was most surprising in these patients was that less than 25% had two or more than one risk factors. Meaning 75% of these young fellows with severe form of heart disease had either one or no risk factors. You would expect this guy would be smoking, obese, all bad food, bad cholesterol, bad thing. You might have multiple factors, but only 25% had two or more. 75% had only one risk factor. We Indians, as a genetic race, are prone for heart disease. If you say calculate the overall worldwide incidence of heart attacks of people less than 50 years of age to be 25%, in India it's as high as 55 to 60%. We are prone for heart disease. What we can't see, genetics loads the gun and our lifestyles and environment pulls the trigger. So we can't help that we are born with a loaded gun. There's no doubt about it. Only thing what we can do is we can try not to press the trigger. That's all. That's where our lifestyle choices, and that's where running kicks in. And if you think that running a marathon would help you from heart disease, it's not correct. It'll probably prevent you from getting severely affected. But your 150 minutes of intense exercise should do. That is enough. Anything beyond that, you are doing it for your own personal satisfaction. So if you think that, so that's why a very comprehensive evaluation.
Are you actually saying being fit and being healthy is actually not the same?
It's of course not the same. I'll just take a minute on that.
Being fit in a healthy way.
Being fit is just that you can run so many kilometers or you can cycle so many kilometers. That's a task you can do. You can always, I can do it. But that doesn't mean that you're healthy. Healthy means you have to, going back to our MBBS days, health is a complete state of physical, mental, social well-being and not just absence of disease. So, a lot of people have health, a lot of so-called fit people have mental issues. Lot of so-called fit people have nutrition issues. Lot of so-called fit people are actually obese. Lot of so-called fit people have so many other issues. So we need to look at health at a 360-degree point of view and not just from the lens of running.
Thank you, Dr. Amaresh and Dr. Raj. So, we are always encouraged that never give up and what doesn't kill you makes you stronger. So, Sunil, this question is for you. How can we spot the red flags even before it's late, especially like during a marathon or on a race day? What are the red flags that on the route people have to pick up? This is for my team.
Yeah, no, so first thing, definitely, like I said, you should keep an alert of your heart rate. Number one, just set an alert for your threshold. No, don't cross that threshold limit. Now, if you are feeling breathlessness, you're running out of breath. You've lost the sense of direction. Okay, and like Dr. Rajasekhar already pointed, chest pain or anything, that's a red flag. So you need to make sure you stop there. You call for help. There's no harm in calling for help, no matter what people think about you. You're a great runner, whatever. If you're going through a pain, it's better you call for help, take medical attention. So that is the one thing that we need to make sure. And second thing, like I said, do a run, walk, run. That's very simple. Make sure that you're hydrating. Now, when I say hydrating, it's not just drinking plain water and not only sodium. Now, the main problem, one thing I wanted to also talk about is supplements, right? We are always against supplements. We don't like supplements. But one thing you need to remember is, our food. Okay, we are being overfed but undernourished. Yeah, right? You just see your food, you're being overfed but undernourished. So you need to know what you're eating, how much you're eating. I was just coming on in the metro with Leena and Veda, and they're saying, what is the one thing that you need to eat? So I would say one fruit. The one fruit, if you want to go with one fruit that you need to eat daily, you know what it would be? I knew that answer because I got the same answer. No, no. Wait. I'll tell you. Don't. You can name all the fruits. Pomegranate. You should have this pomegranate daily. It is a lifesaver for all of you, especially people who are doing endurance training. Never do without a pomegranate. Now, when you go home, before you go to the market.
Go to the market, pick up the pomegranate.
And now from tomorrow onwards, the pomegranate prices will rise up. And then there will be a joke. Should I buy pomegranate or drink a beer? Okay. Sorry? No. To trace back, when I wanted to create my own company, hydration company, which was going on. But sadly, I had already started it. And 2019, August, I had launched my hydration company. And it busted in March 2020 because of COVID. So if COVID had not come, definitely I was going to plan to have a hydration drink that contains pomegranate. And because that is the most important thing. So that is simple. Everybody can have pomegranate, right? Nobody is allergic to pomegranate, I suppose, right? The second supplement, and I'm talking about supplement, the second most important supplement that everybody should have. Supplement I'm talking about now, not fruits and medicines. I'm talking about supplement. Is magnesium. Magnesium is the most important supplement. Like Dr. Ashwini said, sleep. You have to have magnesium after you have your dinner. It will aid you in muscle recovery. It will aid you in good sleep because your sleep is the most important factor. Magnesium is the most important mineral that you need to have. Remember one thing, when you're sweating, you're not losing only sodium, my dear. You're losing potassium, you're losing all the minerals that are there in your body. Vitamins and minerals, you're all losing that. Okay, there's one more supplement that I always recommend people before the marathon and after the marathon. Okay, and that's a very simple supplement that you can even have through oranges. It's vitamin C. Okay, I always recommend vitamin C 4 to 5 days before the marathon. Okay, that's my protocol. Okay, I do not know if doctors agree with me or not, but I follow this protocol of having vitamin C for 3 to 4 days because it helps you in making sure that you are fresh for the race. It's an antioxidant definitely, but it also makes sure that you're fresh for the race. And later on, vitamin C is very important post-marathon because your immunity level is down. Your cholesterol level, your cortisol levels are high. You're more immune to illnesses like flu or whatever, or you get sick and all that stuff. So vitamin C post-marathon is also very important. And you can have it through natural sources or you can have vitamin C tablets you get on the shelf, right? So these two supplements are the most important supplements that you should always have in your kitty. You got my point? Okay. So, yeah, did I digress? I digressed, right? Sorry.
Spot the red flags. You said chest pain and all that. You did it.
Yeah, and I always recommend run, walk, run. I always and always I always tell people,
I had one more question for you when we are still on race day. I mean, I'm sure you as a coach would have, seen this quite a bit. We all as the running community do see that. We're all training for I said event, training well, everything is going good, and then just that race week, you either under the weather a bit, or you had a nasty sprain, or one of that. And you obviously don't want to miss out on the race. You've been training for 16 weeks. So, is it okay to just munch on one painkiller and go 4 or 5 hours? I'll be done. And after that, I will rest.
Yeah, that's the most dangerous thing that you should do. If you want to kill yourself, definitely go for a painkiller because brufen. Most people stick to brufen. I'm against painkillers.
Commonly taken is brufen.
Yeah, and I've seen people. I've seen my own friends. Who have done really good PBs and all take painkillers, and they even offered me. I said, no, boss. I'm going to run with pain. I love pain because pain is an indication for you to stop. Don't suppress it. If you try to suppress pain, you're trying to suppress your body's mechanism to alert you that something is wrong with me. Please stop, right? If, like Dr. Rajasekhar said, these warning signs will be bypassed if you take, brufen, right? Painkillers. So, yeah, so don't go with that. That's what I would recommend.
One last question to Dr. Rajasekhar because I really liked his thoughts when we were discussing the other day. After that, we'll quickly do like a rapid fire. We'll do all the questions that came from the Google form. So you were talking about avoiding overtraining and also having a phase of retraining.
Yeah, there's an important and unrecognized fact about endurance sport. So if you look at the hearts of lifelong endurance athletes, they have larger hearts. They're large-hearted guys. So their heart chambers are larger. The cells, the heart cells are bigger. So because of a process called hypertrophy of the heart. This is an adaptive phase. So normally when somebody is running at 6.5 pace, his heart is generating an output which is 700% above the normal. So because to sustain that, there's some adaptive changes that occur in the heart, and therefore the heart enlarges in size, and then it becomes more efficient as a pump, and it handles the rate increase and decrease in the rates more efficiently. So this is an adaptive change that is occurring in the heart. But if somebody is continuously doing the same activity, over a period of time, people have shown that there is increased calcium deposition in the arteries of the heart. There is this thickening of the heart muscle, and there is something called fibrosis. Fibrosis is normally it's an elastic tissue, the heart muscle. So when it becomes fibrotic, when fibrotic tissue comes in, it becomes it loses its elasticity, it becomes more stiff. So it causes problems such as, over a period of time can cause problems in the functioning of the heart. It can cause problems in the heart rhythm. And it has been noted that many of these people have a slightly higher incidence of irregular heartbeat called atrial fibrillation. There's a condition where there's an irregular heartbeat which has its own health consequences. So a lot of heart physiology scientists have proposed that there should be a period of training for your marathon, and once you finish the marathon, there should be a period of detraining. So where you unwind, you let the heart to recover. It doesn't mean that you become a couch potato. It doesn't mean that you sit on the beach and enjoy a mug of beer. You can do your fitness, but bring down to physiological levels. Do your 5 kilometer every day, do your strength, do your yoga, do your breathing exercises. Come back to physiological levels. You give your heart the adaptive changes that have occurred in the heart to regress a bit. So that way you actually delay or avoid this process of permanent changes in the tissues of the heart, which can have health consequences. That's just one thing. So that's why, this, as Sunil said, so people want to get into the Guinness Book of Records. They do a marathon every week or a marathon every day or whatever, marathon in a different continent every day of the year or something like that. So that is okay once in a while, but I think that's not good for health, not good for heart health. So again, it's statistics. Statistics say, okay, statistically may not be significant, but for an individual, statistics is either 100 or 0. So it's better not to do this. So that is where the importance of detraining is there. So you train for an event, then you detrain, give yourself enough gap for recovery. I mean, this is recovery from an event before you go on to another event. I think that's what it means.
Does this include recovery runs? Okay, I hear recovery runs. Can you?
That is short-term recovery. This is long-term recovery.
No, I think there's one more point that I just want I think you got reminded. One thing that I always recommend people is after you finish your run, stretch, cool down, walk for some time. I've seen people directly get into the car and drive home. That's a very wrong thing. So cooling down process has to happen. You need to go down. I have a cool down stretching mechanism. It's for 10-15 minutes. Stretch your body, cool it down, walk for some time. Walking, that cool down process is very important. Same thing when you finish your marathon. At the finish line, don't just stop there and go and stop. Walk for some time, stretch out, just keep moving. Even after your marathon, you need to keep moving. The more you move, the faster your body will recover. Don't sit there immediately, right? Let your body process 15-20 minutes. If you walk, nothing is going to happen. So keep hydrating, keep walking around, keep stretching, and then probably if you want, you can sit. But a proper cool down is very, very important.
One important observation is that a lot of these adverse events that have been reported during events, they typically, most of the time, happen soon after the event. They do not happen when he's doing his peak he's doing a pace of 5 in the middle of the race, he's doing very well. He finishes the race, then he collapses. So people wonder, how come he was running for 3 hours, nothing happened, and in the 5 minutes after the run, he collapsed. So what happens is when you suddenly stop the exercise, there is what is called sympathetic withdrawal. There is a sudden withdrawal of the adrenaline in the body, and that causes a sudden precipitous fall in blood pressure and pulse rate. So that causes drastic reduction in blood supply to the heart and can cause a heart attack. So you don't stop suddenly, you just cool down. So the moment, the first time I did my half marathon, I was very happy. I thought I was very tired when I stood. Then the moment I stood, I was feeling reeling. I started walking, I felt better. Yeah, it causes pooling of the blood in the legs. And then there's a fall in the blood pressure, fall in the cardiac output, and that causes a lot of serious adverse effects. So you have to keep walking, keep fidgeting, keep doing things for at least a few minutes before, so that you slowly unwind from there.
We'll take one is if there are any questions, you can pass them on to Krishna who's sitting here. But otherwise, I have a few more questions which had come in on the Google form, so we do it as like a rapid fire. We don't have much time. We're supposed to finish off in 15 minutes, I believe. So we were speaking about hypertrophic cardiomyopathy, which happens to runners. One question from Harshan Hussain Dahod was, can I avoid, how can we avoid getting cardiomyopathy and, so that I can continue running for a longer time? Is there anything they can do about not getting it if they're a runner, or is just an adaptive mechanism, it will happen?
No, that's what, you need adequate retraining. You need adequate retraining, and you need
and is this the same as athletes, not any?
See,
yes.
To cut a lot of technical jargon short, To cut a lot of technical jargon short, if you are thinking of quitting running because you might develop an athlete's heart or you might develop cardiomyopathy, you won't. You know, the guys who have that Duracell which goes on and on and on, they are the ones who are more likely to develop these kind of things. Guys, keep it simple. Remember what you are running for, and just, if you are tired, stop. Why do people fail to recognize everybody knows what the warning signals are. Chest pain, knee, shin splints, or, Achilles tendinitis. Everybody in this room knows more about it than any other doctor. They have read about it million times. Experience. Why do we fail to recognize? This is his domain, but I'll tell you.
Because you don't want to recognize.
DABDA, denial, anger, bargaining, depression, acceptance. Denial. You deny. Arey, that is not chest pain, because moment I stop for a minute, I'm able to run for a kilometer more. That is not shin splints. Anger. Those bloody Nike shoes are bogus. I ran on the Hussain Sagar, which is full of concrete. Those are anger. Bargaining. Okay, maybe I can, I will stop for a day or two and then I'll do it. The bargaining may even mean Tirupatlan and Padikaparkail Gortani if I get better or not. Then when the intensity hits and reality sinks, you have depression, and after you go through that depression, you have acceptance. So let us all remember what we signed up to run for. And let us not deny what our symptoms are. We all know them. Let us recognize them. And why is rest so difficult to do for people? Because running we can do. You know why rest is so difficult to do rather than running? Because we do running as a group, we enjoy it, but we are left to rest all by ourselves.
Rest as a group as
The
well.
fear of missing out. Please, guys, in all this technical jargon, keep things simple. You all know what is required. You all know what is there. Please. I remember how many people in this room know running is good for health. All hands went up. This is 15 years ago when Rajesh came to NIMS. How many people know that running is important? Hands up. How many actually run? How many people know rest is important? How many actually rest? Life has come a complete 360 circle reverse. That's all.
Thank you. Sunil, there was a question from Rashmi Vyas. What exercises would you recommend for stay-at-home mothers, as in elderly mothers who can't go out for one? By elderly, I mean like 60, 70 years old. They said mothers, stay-at-home mothers. This is a question just come on Google Form, not my question.
No, see, it's good. I always recommend home-based exercises. Easiest is to use TheraBands. You go to Decathlon, you get those TheraBands, and this is the simplest form of resistance training. Okay, the best way to improve muscle strength is resistance training. The more you do resistance training, the faster you will develop. So, and again, but always remember form is important. So if you always need to not compromise on your form, then you should always use something called a wall or something, so that if you're doing a squat or whatever you're doing, you put your back against the wall and do a squat. So remember one thing, just because you're strength training you're doing does not mean you will not cause injury. Because if you do it in the wrong way, it's definitely going to cause injury. So your form is more important than you do anything.
Sunil, does ghar ka kaam count as exercise?
Of course, Ghar Ka Kaam definitely counts as an exercise if you even do sweep the floor or whatever.
Functional training.
But again, people do it in the wrong way. Right? Again, form is important when you're sweeping. Don't sweep like this. Sweep like this. I mean.
All right. How much time can we run every day? This is 100 days of running times.
See, Kipchoge runs twice a day, right? And one in the morning 20 kilometers, in the evening 23 kilometers. Obviously, I will not recommend all of that to you all. See, simple 30 minutes of, I always tell people, 30 minutes of exercise is good enough. just show yourself out of the door, whether it's a walk or something, you're not feeling good, you're still, thinking about work stuff, just go out and just spend 30 minutes for yourself outside. The important thing what I want to tell you is change the environment you are in. I always tell people, staying at home, looking at the four walls, is not
And the
going to make you a
mobile
genius.
and the laptop.
Yeah. So I always tell my trainees, I always ask every Tuesday, I send a message, what have you done? And people say I'm busy and all that. I said, go out. Whatever it is, just go. Change the environment. The moment you change the environment, your mental and physical thing changes. Your breathing changes, everything changes. So not necessarily that you have to run every day, but every day go out. Whether it's a walk, whether you want to go to the park, socialize, meet people, talk, laugh, do things.
It also works as a stress buster.
Yes.
Dr. Amaresh, yeah, sorry, quickly.
Just another point on the everyday running. Although everyday running, may not be great all the time, but there are some people who would like to run every day. But if someone wants to run every day, just make a note of the heart rate zone Sunil was talking about. Okay. Now, 20 to 30 minutes of run every day in maybe zone 1 heart rate. That would probably be around 60 to 70%, maybe under 70% of maximum heart rate, or maybe around 75% of threshold heart rate. So someone who's probably age of 40, if the person runs every day at a heart rate of between 110 and 130 or 110 and 135 every day for 20 to 30 minutes, probably should not be a problem. This heart rate, how it helps us, a heart rate actually tells us our effort at running. The higher effort of running will cause more impact on the rest of the muscles of the body. So when we are having a lower effort of body, we are having a lower heart rate, and injuries don't develop too much. So, thanks.
Dr. Amaresh, why is the male ratio higher? Very
This
valid
is another myth that, see, females are protected till menopause. There's no doubt about it. The body protects the females till about menopause. But when I said we did a study on young age heart disease, for less than 40 years, we had 20% of them females as well. That's a very high number. That's a very high number. Almost 1/5 are females is a very high number. One of the reasons why we have seen a lot of females have left main diseases as well, because there's a lot of inflammation in the body. There's a lot of what is called as aorta arthritis. They're prone for autoimmune diseases. And so these also, inflammation of the blood vessels causes poor vascular health. So it's not just the cholesterol deposits as well, but in general, overall inflammation causes these diseases. That's why women are also not spared. And that's why running in a way is also a form of stress to the body, and apart from other stresses. That's why the importance of recovery, that's why the importance of rest, and that's why the importance of calming down the mind. Running is just one aspect of health. There are so many other aspects of health which we need to develop as well. And so when we want to insure against a heart disease, I think we should have this 360-degree view rather than just from a running perspective.
Ashwin, so if one has a high BMI, can he or she start running, or should they first lose some weight and then start running? What is the right thing to do?
Yeah, actually, this is something that there is a lot of talk on this topic too. Now, again, running may not be for everyone. See, what's important in fitness, is about getting into some activity which increases your heart rate up to a certain level. If you see, if someone says, okay, I walk in the park every morning for half an hour, but if that walk is not pushing your heart rate to above 100 or 110 beats per minute, probably it's not helping you in any way. You walk slowly, talk on the phone, other than breathing in fresh air, we don't know how much of that walk is actually helping your heart. But then, whether it is walking, whether it is running, whether it's any prolonged activity, a little bit of intensity which might cause a change in body metabolism, for example, fat burn, or maybe some releasing the stiffness of the muscles, would be pushing up the heart rate to zone 1s to zone 2s, Zone 2s would be good. Zone 2s would be anyone say, we'll have to put yourself in the calculator or something like, and something between 110 to 140, 120, 110 to 135 would be just enough. Whether it's walking, whether it's running, whether it's cycling, whether it's swimming, get your heart rate for between 110 to 130. Of course, this is not generalized for everyone. I'm just giving you a guide where this prolonged done for 20 minutes to 30 minutes would probably have some benefit. Now, if someone with a higher BMI, you just want to say, okay, I've not done anything for the last, say, 30 years, but now I want to start running. It may not be a wise idea because running is an impact sport. You run. We don't, very few of us have synthetic tracks to run on. We don't have even grounds to run on. We run on road, we run on pavement most of the time. We run on tiles. So it's a very high impact sport. The impact each step gives on our feet, on our ankles, on our knees, on our hips, on our back, on our shoulders is immense. So it's very important for us to precondition ourselves for the running if we are running for the first time. There's this thing called as preconditioning, where you start with walking first, slow walk, push up the walks, go into a walk to run method where the walk is more and the run is less, then go up to a method where a walk and run is equal, then go up to where a run is more and the walk is less, and that is when probably will be a good idea when that person will be able to start running. Of course, probably until the preconditioning to running culminates into complete running, it's possible that the person may not have lost a lot of weight, but in that time, the muscles would have got conditioned to running, the joints would have got conditioned to running, and the person would have gained a lot of strength in these walking and running muscles to start running.
Thank you, Ashwini. So for paucity of time, I am not taking any more questions now. They're all here, so the minute we close, you can pounce on them and ask them all your questions. I invite Rajasekhar to come over. I think you wanted to.
It's time to tell a few words on this session and why you are doing. Let's not hide it away from why we had to do this also. But I just wanted to kind of tell a few things on this entire thing. So when we started this group and traced my journey 20 years ago to why I was doing what I was doing, it was in KBR only that when we started this group to have people train for marathons. And then somebody came and told me, why marathons? I just want to run. And that was the first thing. Then I realized that, okay, people have become so inactive that now people just want to run. So that was the idea that when we kind of developed this idea of, Hyderabad Runners' vision is to create active lifestyles and make running as a preferred form of fitness activity. So Ashwini was talking about sedentary life. It's inactivity. Everything is today automobile, auto phone, automation, every single thing. So what you do in that 1 hour is not what is important, what you do through the day. So a few things, I always see that if it's anything below, up to 3 floors, I will climb. Even in my house, I live in the 9th floor, I'll go 3 floors and then take the lift. I will not take anything up to 1.5 to 2 kilometers, I will walk. Unless it's raining and I have a lot of weight to carry. I have my car parked the farthest in my office so that I can walk. And my office seat is the farthest from the toilet. So these are all small things which I decided to do. And I'm just telling you that, so it's just not part of this. So it's about active lifestyle. Why active lifestyle? So today, if an obese person comes, first tell them, decrease weight or don't eat this. He will feel that as if something has been taken away from him. So they will not get started. So it's a very well-known research to show that if people can lead active lifestyle, and it will move on. How many of you are here from Couch to 5K programs? Move up. So plenty. So when we started that, we thought if we make them active, then we realized that, okay, now I can do this cycling. Some people have done yoga, Zumba. That is important. And then they come back and say, Ajesh, I did this in 40 minutes. Can I do in 35 minutes? So then he is bitten the bug. So then he will come back and say, I did 35 minutes, what next? Then I'll tell, go to a nutritionist. Then now he's getting sucked into the entire thing. So this is how it is. But as people are saying, it's just not about running, but it's about food, it's sleep, stress, so many multiple things. I just have to kind of thank all the people, but summed up a lot of things. I just want to say a few words. One of the first thing was strength training. So running is the first love for many people. I would say mother-in-law is strength training. How many of you would agree that your wife or your spouse is not here because of your mother-in-law? So it's very, very important. So I keep saying that, the shortest thing is, getting up from the bed to bathroom. There's the longest mile for people. So these are the small things which we have to do. Thanks on checkups. If I ask how many people went for checkups post hearing those 2 deaths, how many people? Be honest. And be honest. No, I know a lot of people have gone. So this was something which you could have done earlier. You didn't have to wait. So we are living in a snooze world. I grew up in a day when alarms were analog. So once an alarm was pressed, I used to switch it off, get up, and that was good for my life. Now it's 4 o'clock, 4:15, 4:30, 4:45, 5, 5:15, and you still say that I didn't wake up. And that is a good analogy of life. So all the early warning signals are there, just you're not following. So that is simple. And then coaching community. Thanks, Sunil, for telling this. What is the responsibility of coaching community? What is the responsibility of coaching community? When we started the training programs, it was a very good intent that I realized that I made a lot of mistakes in my training, and we started this thing. I had some program by Bill Pierre, somebody by this thing. It was to not follow a particular program. It was to bring discipline. It was to make people understand. That was the challenge. People didn't want to do this. And now, as Sunil has told, the challenge of coaching community is very, very heavy. I mean, he was very polished in saying that a responsible coach. But I'm saying you that it's irresponsible coaching. It's complete irresponsible coaching. I don't want to mention names, anything. So anybody just doing this thing. I know people who say that I'm an ex so-and-so runner, so-and-so runner. I know somebody telling me that I'm using my coaching money not for my thing, but for a charity. I don't believe in all this. It cannot be a gig. It's not an Uber driver or a Swiggy delivery boy or anything. It cannot be gig. I'm being very critical of them, but I'm telling you the truth. I'm not telling you come and train Hyderabad Runners or somebody. This is a serious sport. Beyond 1 hour, if you're doing something, it's abuse of the body. So you'll have to do this thing. So all through this, my wife was seeing me so many times because I managed to sail through this 20 years of my journey in this thing. So she was telling me if I don't eat this out, if it's this thing, so it's there. So there's a lot of family pressure. Whatever you do is going to impact your family. So please be careful of that and the entire work. First is personal, next is professional, and then comes your passion. The idea of taking up a passion is to better your personal and professional life. If that is going to be the stress, just get off it. Very simple. Why I'm trying to tell you is, I wanted to sum up this. Thanks for giving me the opportunity, Madhu, for telling all this. There were a lot of technical things, but I'm just telling all non-technical things, which are very useful. And I would want to tell that. So I somewhere thought we should democratize running. And I realized like democracy is a dangerous thing. And that is what is now. So democratization of running is not happening. It's something else is happening. It's very sad. So all the people here have a very, very responsible role in doing what you're doing, influencing people or inspiring people around you. The idea of just running 100 kilometers, the idea of running 50 kilometers, I don't think it makes sense. Absolutely not. If you're doing it, do separate. You're on your own trip. Don't get the common people. Social media, the lesser told, the better it is. I'm glad when somebody seeing on the Facebook live told me I'm getting off Strava. I told him congratulations. So if this could get 20 people off Strava, very happy. So that's the thing. And then online running communities I mentioned. Coaching responsibility I've told you, very, very steep. So one interesting thing which when I started this group in 2007, so one of the things that helped me, this thing was I ran the New York Marathon in 2007. And I had a chance to meet so many people. very interesting, some few names, Hal Higdon, Bill Pierce, Amby Burfoot, who are like fathers in this entire thing. So I went and talked to them. Okay, why did you kind of do? So they went, told us what America went through in terms of a prosperous thing, ill health, and they wanted to do something very simple. So all these people have researched 25,000, 30,000 people. They came up with the schedules. What was important is none of them commercialized it. There was no authorized trainer by so and so person. Because it's just for the passion of what they would do. They could have made loads and loads of money by certifications. They did not do. So it's really democratization of running which they wanted. And they're very good about telling that they got their money from just the books royalties. I mean, it's a different thing. They did make good royalties on books, but they never authorized. So why I'm trying to tell you is, you shouldn't be carried away by licensing and all these things. It's much simpler. Keep it simple. It's very good. So the motto of Hyderabad Runners has always been about discover yourself. I don't know how many of you remember that I've seen it. You genuinely discover yourself. Don't do anything for the other things. And so thanks once again for all the people. So, sorry, idea of detraining. How many people, they don't realize that rest is different, recovery is different. So detraining is something which I always do after an event, after a running season, every this thing. So if you don't know to practice this, it's very difficult. Then thanks Dr. Amaresh. This was the first thing which I got when I started my marathon running in 2003. Dr. Hemant Kalyan, Manipal Hospital, Bangalore. So some friend told me to get a CT angio. Then he asked me, is something wrong with you? I told why. Who asked you to? Why do you want to do it? What is your apprehension in running this? Then I told him I have a rich family history of disease. And my father passed away when he was 37. So then he told me, he showed me the picture of a gun. You know what is this? This is your body. You know these bullets? These are your genes. They're all loaded. If you press the trigger, it will happen. So if you think you're going to do this and you will put away some problems, don't do so. You're minimizing the risk. That was my first thing of the doctor telling me, and then he brought in some sense in how I thought, what I did. And he was very clear. He was a guy, sports specialist from this thing. And so that is the entire thing which I just want to tell you, that what in Hyderabad Runners we have here is something different. You know, you all have a very, very big responsibility in doing what you're doing in a responsible way. I am telling you that's very simple, because every single person who is watching you, your family, friends, workplace, and the name will fall on, the running aspect of it. It's unfortunate that 2 people died, and it was for multiple reasons. We don't want to get into it, poor souls, may their soul rest in peace. Let's not get into it. But at least that should trigger off what we are doing, what is it. We need to revisit our entire approach to what we are doing. That's very important. We need to be, I seriously think we have a role to play. I seriously think it's important, because as all the doctors, they know that the biggest problem today we face as a country is inactivity. And we want to be a superpower, strong thing. You have the most unhealthy nation in all parameters. I think all would agree on that. Mental, social, everything. So you have a very big role to do in what it is. So with these few words, I thank Madhu for giving me this opportunity to express it. I felt like doing that because let's not get away that those 2 things have left the community shell-shocked, the families shell-shocked. So whatever you do, you have to be very, very responsible. Thanks, and I hope this message can be conveyed to one and all. What you want. Thank you very much. So as Krishna told, he's the best person to run with in area. I know Madam is here. She was the other day we met in restaurant. She was telling me anything more. Thanks Sunil for the thing. But as I told you, coaching thing. I want the coach is full time. Then go.
Doctor. Prashant, can I have you?
Dr. Madhu? I think, Arun, but Dr. Just join for a photograph.